Assalamualaikum, I am Aya Famisi Makalindao and we are the group of lung cancer. So I am with Rauf Gomez and also Joanny Patangan. So my assigned part will be the brief description of the disease and also its disease process. So lung cancer is the leading cancer killer among men and women in the United States with almost 160,000 deaths estimated in 2012. So approximately 226 new cases of lung cancer are diagnosed annually and 14% of it are new cancers for men and women involved the lung or bronchus. So what happens here is that 70% of those patients with lung cancer is having a hard time to cure the lung cancer because the disease has spread already to regional lymphatics and other sites by the time of diagnosis. So its long-term survival rate is low. So lung cancer is a cancer that starts in the cells that make up the lungs. So the lungs are sponge-like organs in your chest. Their job is to bring oxygen into the body and to get rid of carbon dioxide. So there are two types of lung cancer. We have this non-small cell lung cancer and also the small cell lung cancer. So for the non-small cell lung cancer, it is most lung cancers are non-small cell. So they are named for how cancer cells look under a microscope, and there are a few different types such as squamous cell carcinoma, adenocarcinoma, and large cell carcinoma. So it is categorized, the lung cancer depends on its appearance on the microscope and its size. So 85% to 95% are the most common type of lung cancer, which is the non-small cell lung cancer, and it is very rare for the small cell lung cancer, which is 10 to 15% of the lung cancer. So usually in non-small cell lung cancer, it arises in the outer region of the lung. It may look like a pneumonia on chest x-ray and more common in women. So there are confirmatory tests for us to identify if it is lung cancer. We have here the small cell lung cancer. It is most aggressive type, rapidly growing to many sites within the body and strongly related to cigarette smoking. So we have here the types of non-small cell lung cancer. We have the adenocarcinoma, squamous cell carcinoma, and the large cell carcinoma. The difference here is that the adenocarcinoma is usually begins in the outer regions of the lungs, while the squamous cell carcinoma begins in the bronchial tubes, while the large cell carcinoma begins in the outer edges of the lungs. So the adenocarcinoma and also the squamous cell carcinoma are typically slow growing, while the large cell carcinoma is fast growing. So the most common here is the adenocarcinoma. So we have here the different, further discussing the difference, we have here the adenocarcinoma. So it begins in the glands in the alveoli, usually in outer part of the lungs. While here in the squamous cell carcinoma is that it begins in squamous cells. That's why it was called squamous cell carcinoma in the bronchi and usually in the center of the lungs. So here is in the alveoli, the other one is in the bronchial, while the large cell carcinoma begins in large cells, so found anywhere in the lungs but mostly in the outer part of the lungs. So let's proceed to the small cell lung cancer. So it is less common than non-cell lung carcinoma, sometimes called oat cell cancer, and this is because the cancer cells are shaped like oats when looked under a microscope. So this type of lung cancer may grow and spread faster than the non-small cell lung cancer. So it represents 10 to 15% of tumors and has two general cell types, include the small cell and the combined small cell. So we have here the risk factors, those people who are smokers, those people who are exposed to environmental and occupational agents. So we have here inhaled carcinogens from smoke, radon gas, occupational and environmental agents. So there's a rise from single transformed epithelial cell in the tracheobronchial airways in which the carcinogen binds to and damages the cell's DNA. So itong transformed epithelial cell will bind to the carcinogen and then it will damage the cell's DNA. What happens here is the damage results in cellular changes, abnormal cell growth na. Then it will, the damaged DNA will pass on, the damaged DNA will be passed on to the daughter cells and then it will undergo further changes and becomes unstable. Once it becomes stable, the pulmonary epithelium undergoes malignant transformation from normal epithelium eventually into invasive carcinoma. So malignant meaning it can transfer to other part or regions of the body. And then carcinoma tends to arise at the sites previous scarring in the lung. So we have here the lung cancer staging. We have here the stage 0, which is carcinoma in situ, meaning where the cancer cells started. So in stage 0, abnormal cells are found in the innermost lining of the airways. These abnormal cells may become cancer and spread into nearby normal tissue. So it is also called, the carcinoma in situ. We have here the stage 1. The cancer has formed. Stage 1 is divided into stages 1A and 1B. So in stage 1A, the tumor is in the lung only is 3 centimeters or smaller. While in stage B, 1B, is that it is larger na 3 centimeters. So cancer has spread to the innermost layer of the membrane that covers the lung. The tumor partly blocks the bronchus or bronchioles and part of the lung has collapsed or developed pneumonitis or inflammation of the lung. So we have here the stage 2. The tumor is larger than 4 centimeters but not larger than 5 centimeters or smaller, and cancer has spread to nearby lymph nodes on the same side of the chest as the tumor. So yung mga near na lymph nodes is maapektuhan ng cancer cells. So in the stage 2B, we have also stages in the stage 2. The tumor is 5 centimeters or smaller and cancer spread to the lymph nodes. The difference here is that the cancer has spread to the main bronchus but has not spread to the carina. And then stage 2B, 2, and then here in the stage 2B2 is that the cancer or the tumor larger than 5 centimeters but not larger than 7 centimeters. So there are one or more separate tumors in the same lobe of the lungs as the primary tumor. So the cancer has spread to any of the following. The membrane that lines the inside of the chest wall is could be affected. The chest wall also, the nerve that controls the diaphragm, and also the outer layer of the tissue of the sac around the heart. So as we can see here in the picture is that the chest wall and also the heart is being affected na dun sa cancer cells. So for the stage 3, the tumor is 5 centimeters or smaller and cancer spread to lymph nodes on the same side of the chest. So nag-spread na siya. The lymph nodes with cancer around the trachea or aorta, or where the trachea divides into the bronchi. So nag-spread na yung cancer, nag-metastasize na yung cancer. For the stage 3A is that the cancer spread to the lymph nodes. So it is in the stage 3. So the tumor is any size and cancer spread to any of the following. We have here the trachea, pwedeng nag-spread na dito sa carina, esophagus, breastbone or backbone, the diaphragm, the nearby blood vessels, and also the nerve that controls the larynx. Now let's move on to the stage 4. So for the stage 4, the tumor may be any size and cancer may have spread to the lymph nodes, or one or more of the following is found. So maybe there are one or more tumors in the lung that does not have the primary tumor. The cancer is found in the lining around the lungs or the sac around the heart. The cancer is found in the fluid around the lungs or the heart. And then the cancer has spread to one place in an organ, not near the lung, or such as brain, and then the liver, the adrenal glands. And then as we can see here in the picture is that the left lung is parang magkukollapse na siya kasi na-obstruct yung mga bronchial bronchioles and also the alveoli. So, wala nang dumadaloy na blood flow, nutrients, oxygen. So, parang lumit na in size yung left lung. So, we have here the stage 4B. Cancer has spread to multiple places in one or more organs that are near the lung. So, we can see here in that picture that the cancer cells have already been spread to the body of this person, to the patient. So, also the regional lymph nodes, the nearby tissues, the nearby organs are also been affected. So that is all for my report, and let's hear from the signs and symptoms. Thank you.